I'm Kevin Kawari for Parents TV. As a parent, we've all been there. Your child has a runny nose, a cough, maybe even a slight fever. So what can you do to help them at home, and when do you know it's time to bring them to the doctor?
I'm so sorry. I felt like every time we went in there, well, he's not really sick, he's just kind of teething or something.
The doctor's office, that's pretty nerve-wracking sometimes. It's constantly learning and adapting.
First and foremost, there are so many little aches and pains that kids have and so many different symptoms that pop up. How does a parent know if their child just has something like the sniffles or if it's something more serious?
Well, generally, if they're running a fever for several days, you know, when you're getting to like 4 or 5 days of fever, then they should be checked.
Because kids get fevers a lot for a lot of different reasons, especially at young ages, like, Charlie Rose being 6 months old. So what kind of fever do you look for? Is there a certain level that where a parent should say, okay, this obviously is something serious, I need to get my child in to see a doctor?
Yeah, typically with a common cold, you're going to have maybe a temperature of around 100. But if it's going up to 101, 102 for several days, that means probably that it could have started out viral, but it may have become bacterial.
Okay. And at what point, if you're seeing 101, 102 as a parent, you're going to want to try and control that, I guess, at home first? How can a parent do that? And then at what point do they say, okay, I'm not controlling this, I do need to get in?
Generally, if you use acetaminophen, which is the same as Tylenol, or ibuprofen, which is the same as Motrin, you can control temperatures pretty well. You wouldn't want to use both together, but separately, and in the recommended dose. So, and generally, fever is not going to cause any problems, but it's just a symptom of that there is something going on.
So if you're not seeing a fever and your child has a runny nose, has maybe a cough, and it just seems so uncomfortable, what can a parent do?
Well, recently the recommendations were changed, and they to not use any over-the-counter cough and cold medicines for children under 6. There's concern that some babies may have died because of those cough and cold medications, and I haven't really seen the statistics on that, but they also think that they don't really work all that much, and especially the ones for cough, that they could, if they do work, they could tend to mask a cough that might be asthma or something more serious. What's advised is having your child maybe sleep in an inclined position and use a vaporizer. If you want, you can use the little Vicks Vapor Rub too with the vaporizer. And the other big thing they're recommending is if the nose is stuffy, to use normal saline, and you can get that at the pharmacy, or you can make it up for yourself. And you put a few drops in the nose and then use a bulb syringe to suck their nose out. And with little babies, this is really important because they breathe through their nose, and so they can't breathe very well if their nose is blocked.
So how about prevention? I mean, we hear so much about flu shots. In general, are flu shots safe for kids of any age?
They're thought to be very safe, and now they're recommending that children even 6 months should start getting flu shots every year.
The child gets a flu immunization. Can they still get sick? Can they still get the flu?
Yeah, the CDC tries to figure out every year what the next flu is going to be. And it's usually 2 or 3 viral strains. The shot may start to wear off by the time that your child gets it, maybe in the spring or something like that. But generally it lasts about 6 months, I believe, and takes 2 weeks to take effect.
It's, as a parent, you sort of sometimes hesitate to go into the doctor because you don't want to think, am I overreacting? Really, what's the point where a parent can say, okay, this is serious, I do need to take my child in?
Right. I think if you do the things that I mentioned about colds, and if the child is still coughing, especially at night, not able to sleep, are in pain, really fussy, and not able to sleep at night, then the child should be checked.
We see fevers a lot in kids, especially little ones. So again, when do you know when this really has become serious?
Well, sometimes what can help you is that if your child's been sick, say with a runny nose for a week, you're going a week to 10 days, and then they start running a fever. That's a pretty good sign that it's probably going from something viral, in which there's not a lot of medicines that can take care of viral illnesses, and it's going into something bacterial like an ear infection or pneumonia.
What kinds of things can you do as a parent to prevent your child from getting the cold or the flu?
Mm-hmm. Well, it's not so much being outside in the cold. The big thing is that in the winter we're all indoors more, and so you can get it through air droplet form from other people or from hand to mouth. And so that's why hand washing is so important.
So as you've just heard, there are some things you can do as a parent to prevent your child from getting a cold or the flu. Remember, one of the most important is washing your hands. I'm Kevin Kawari for Parents TV.
Thank you for watching Parents TV, our families, our lives.